we do know how powerful and how much healthier an individual is, how much longer they live with more muscle mass. If it were that easy, we've been following that game for calories for the past 60 years, and it clearly hasn't worked. So there's a lot more to it. And what is more to it is the second signal besides the deficit or the surplus of calories, which is the presence of insulin.
If you're building your proprioception, that is your body's awareness of itself in space, and if you're building your neuromuscular fortitude, your balance, you're not going to fall during that eccentric contraction. You're going to be able to go down those steps.
If we want smooth, sustainable, lasting weight maintenance, we're going to have to at least two components towards building muscle mass, like with that sort of motivation, like Rhonda says, is both taking time where you actually are trying to increase the scale, like actually trying to gain weight. But the part that we should also be considering is
exercise mandatory for weight loss and weight maintenance?
Can you do it without cardio? Probably, and then that's where we get into the nuance of it. But just not even getting there yet. Lasting weight loss, you need at least this.
Jumping feet first into today, Dr. Jones. Are you ready?
Yes, sir. Let's do it.
All right, man. So this is contentious. You hear about this. Is working out necessary? Is it not? Abs are made in the kitchen. You can't outrun a bad diet. You have Mindy Pels. You have Dr. Fung. Everyone has their own advice and solutions and recommendations. But I want to hear from you. And specifically, the question is exercise mandatory for weight loss and weight maintenance? And please explain why.
This should be a straightforward question, right? But when you really think about it, there's just so much nuance to it. Okay, so I think we really need to categorize the question into short-term weight loss and long-term lasting weight maintenance. And you did mention those two parts, and they're different answers. And that's why I really want to separate them. So acutely for the short term, you do not need to exercise. And we've already proven this. We have probably out of the thousands of patients we've helped, I'd say probably 15-20% of them, I mean, at least from my reality, in all intents and purposes, there's probably plenty of people that said they exercised and didn't do it. So let's just call it 25%. Didn't exercise and got great results. And, a lot of it is they're unable to exercise because they're in so much pain, physical disabilities, physical limitations, injuries, morbid obesity, whatever it is. And so regardless of it, acutely short term, regardless of the reason, acutely short term, you don't need exercise to accomplish not only just weight loss in general, but even good weight loss, because we can get into, and we have so far, right, into unhealthy weight loss. And how I would say healthy, clean weight loss, like what we preach with the fasting and the improvements in metabolic health, all of that can be accomplished without a single ounce of exercise. Now, I'm sure we'll get into it on this one or the next one. Like technically weightlifting is falls into exercise, but it really shouldn't. But technically, even without weightlifting, you can achieve on the short term. But when we take a step back and we look at the other question, I think the more important one that people kind of sometimes forget, right? There's so much focus on the short-term weight loss that we forget the bigger picture here. The bigger picture is lasting weight loss, right? We have research that already shows us that over 80% of people will fail to maintain their weight loss. And this is all forms of weight loss, doesn't matter. We have research that shows beyond 80. So like closer to 15% of people will actually successfully maintain weight loss past a couple years. And so when you really look at the numbers and how staggering they are, it really paints a picture of the real problem here. The real problem isn't the acute weight loss. The real problem is, how do you make that weight loss last? And this is where I would argue that yes, probably some people could get away with lasting weight loss still without exercise, but where does exercise fall in that category of lasting weight loss? And that's where I would say the majority of us, if we want smooth, sustainable, lasting weight maintenance, we're going to have to at least regularly resistance train. Now, can you do it without cardio? Probably. And then that's where we get into the nuance of it. But just not even getting there yet. lasting weight loss, you need at least resistance training, period.
Right. And that's interesting because, first of all, you're going to have a lot of people listening that hear, don't do cardio, do resistance training. Well, that doesn't make sense. I'm trying to lose. I'm not trying to bulk. Right. I mean, you know this. A girl walks into a gym facility, let's say, saying, hey, I want to lose some weight. I really want to make sure that I can tone down and I want to maintain that for the rest of my life. A trainer says, all right, let's hit the weights. They're going to look sideways at him. So explain that. Why is it that you're going to pick resistance training over cardio when you're looking at sustained weight loss?
Yeah, absolutely. And so when we look at calories, right?
Hmm.
And that opens up the whole conversation about where do calories fall into the weight loss equation. And I have plenty of other episodes where I take a deep dive into this on the YouTube channel. But again, short-term weight loss, calories are everything. You have to be in a surplus to gain weight. You have to be in a deficit to lose weight. We already have the human randomized control studies that prove this. So anybody that says calories don't matter, if they actually mean that versus just saying they don't matter at the end of the day, which apparently nowadays you have to say that now because people take some people literally, and we can get into that. Like people attacking Dr. Fung, Dr. Jason Fung, acting like he doesn't know what he's talking about when I think the man does. But in any case, calories matter on the short term. But again, we're talking about lasting weight loss, sustainable weight loss, and muscle mass plays such an increased and many vital roles for the lasting weight loss equation. One big component is just carrying extra muscle mass on your body burns more calories at rest. And having a faster metabolism does produce better stability in your weight management game in the future because then it depends upon less cardio, less calorie burning because you burn more calories at rest. And there's never going to be an end in yummy, delicious tasting, high calorie food in front of us. And yes, we need mindset control. Yes, we need that. But just having the ability to get away with eating more is a really nice piece of the equation. The second thing is really interesting. So muscle mass and insulin resistance. I actually had
Hmm.
a really good podcast with Dr. Dan Kellums. I call him the wizard. And I asked him the question. I said, hey, does building muscle mass make you more insulin sensitive? Or do you have to become more insulin sensitive in order to build muscle mass? And he was kind of like, whoa, I never thought about it.
Hmm.
And it's almost like asking what came first, the chicken or the egg. It's not an easy question, and we don't have research to actually answer that a question. So it's a negligible question. It doesn't matter because what do we observe as people build more muscle mass? They become more insulin sensitive. Regardless of what came first, it doesn't matter. And so becoming more insulin sensitive, which is synonymous with decreasing insulin resistance, weight stability is skyrockets. I would say
Hmm.
that to me is more important in the game, more important than burning more calories at rest, which I still like. Becoming more insulin sensitive because what that produces is lower insulin levels. Like we get away from those chronically elevated insulin levels or some sort of chronically elevated elevation, right? And we keep our insulin levels low and we keep them really transient. Like a healthy body should only be releasing insulin when you eat. That's the job of insulin. You eat food, blood sugar rises. Your body detects that. The pancreas releases insulin. Insulin does its job. Insulin goes back down. You could have those spikes a couple times a day, and that's fine because over a 24-hour period, the amount of hours where insulin was elevated was really low. Maybe 1 hour, or give or take per meal, right? So you're eating three, hopefully no more than three squares a day, and so that's a very very low amount versus insulin resistance, a situation where now over a 24-hour period you might have some sort of elevation all 24 hours, which is a constant storage signal. And we can get into that whole storage signal from insulin versus calories, like how do you mesh those two together. But in any case, with more muscle mass, we see improved insulin sensitivity, decreased insulin resistance. And I think for me, that's hands down the most important reason why resistance training is significantly more important. On the short term, though, when we bring it back, yeah, you'll probably lose weight faster. If you were a wrestler trying to cut weight, I would say focus on the cardio because you
Hmm.
will lose weight faster. Funny story, when Arnold Schwarzenegger um, became he was trying to become an actor for his first movie role for Conan the Barbarian. He
Hmm.
was too big. He was too big. And so, I mean, he was jacked, but so what they told him, you need to lose 25, 30 more pounds. This was after him already losing weight. And so what did he do? He decreased his intake, he increased his cardio, and he decreased his lifting. So when you have that much muscle mass, okay, fine, right? Like there you go. And plus, he was trying to make a roll. I always think that's fascinating what he did at that point. But he was still jacked when he was an actor, but compared to his bodybuilding days, yeah, he toned it down a bit and increasing his short term calorie expenditure via increase in cardio was one of the things he did. So again, situations like that, okay, fine. Let's push the cardio. But for everybody else, for the rest of us watching, for the 99.99% of us, we're looking for sustainable lifestyle interventions. And cardio, not only do we just discuss why it just doesn't work as well from the physiological viewpoint, but then let's go to the practical viewpoint. Would you rather lift weights 3 days a week or be doing cardio 5 days a week? I mean, you tell me. Weightlifting is just so much easier to adhere to. Becomes a bit of a game too with yourself when you see your strength increasing. It's not monotonous and boring like cardio.
Hmm.
And yeah, we can go on and on about that.
And there's something to be said about the ROI of both activities as well. The truth of the matter is, you can go to the gym and you can jump on a treadmill, get on the Stairmaster, and let's assume that you do an hour of cardio. Well, the average person is going to burn 375, 400-ish calories, depending on intensity in that hour. As soon as you get off that treadmill, get off that Stairmaster, dry off, get in your car, and decide, you know what, on the way home, I'm going to stop at Starbucks and get a scone. You just deleted that entire workout. You could have done weight training, and what people don't understand is you have afterburn. If you're lifting to the point where you're actually causing the amount of micro trauma that you want, your body has to recruit calories. You have to be metabolically active simply just to repair. And going back to the diet versus exercise argument, I always thought of it like this. If me and you had two friends, let's say I had Jack and you had the twin sister Jill, and they both wanted to lose 100 pounds. And for the next 6 months, I got to control every single thing Jack put inside his mouth, but I couldn't touch his workouts. And you got to control all of Jill's activity, but you had nothing to do with what she put inside her mouth. You know who's going to have the better results at the end of the day.
Oh yeah.
But at the same time, understanding that diet is more important. The person who doesn't work out loses mobility, loses bone density, has a higher likelihood of falling into depression and chronic anxiety and general illnesses. So, my question to you is, where do you find the balance between figuring out where to focus your energy?
Between weightlifting and dieting, or between
Hmm.
nutrition would come first before resistance training. So I hate saying that because resistance training is so powerful, but I always try to prioritize my pillars for sustainable weight loss are almost identical to my pillars for optimal health. Like, but there's a little bit of a difference between focusing on the lasting weight loss as a piece for the bigger game, which is optimal health, right? You can't have optimal health without hitting your weight loss goal and maintaining it. So that's priority number one, but it does kind of fit parse and parcel into the bigger, optimal health. So for me, the pillars to lasting weight loss tied in the beginning, tied in the front. So I would say number one and number two tied would be nutrition, which nutrition literally just reducing your consumption of processed foods. So nutrition,
Hmm.
just eating cleaner food. It doesn't have to be, we don't have to overcomplicate it. It doesn't mean following a special formula or, you can get into that if sometimes you have to, if you have an autoimmune disease, avoiding gluten, special particular restrictive autoimmune diets. But from the general perspective, for most amount of people, if they just went 90% clean during their weight loss program and 10% eat whatever you want, and I mean it, eat whatever you want, like reward yourself, I think that they would do phenomenal. And then tied with that, and this is where I spend so much more time talking about, is the regular weekly long fasting. Even though
Hmm.
I just said the nutrition piece is tied in terms of how important, the reason why I spend probably 75% of my time talking about the fasting is because this is the one that's controversial. No one's arguing for the fact that you can eat more processed food and be healthy. Like no one's making that argument. Even like nobody. There's there's big marketing companies and efforts and dollars being spent to fool you into thinking it's not that bad. That's the problem, right? But in terms of just, is it good for you to eat processed food? No one's making that discussion. No one's making that argument, and so we just kind of accept that, and we know that to be true. We don't have to talk about it as much. But the
Hmm.
weekly long fasting, whoa, 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 that's like, oh my gosh, and the amount of crap that we see out there. For example, I saw this documentary on Netflix where they're making fasting to be potentially dangerous. It's like, are you out of your mind? What do you think our ancestors did for millions of freaking years, right? For
Hmm.
millions of years, our ancestors only survived by cultivating and evolving systems within their body to go long periods of fasting. And for the listeners out there, that this you're new to fasting, we have intermittent fasting, which is that short-term daily restricted, where essentially you just take your daily approach towards eating, first calories in, last calories in, and compress it, right? That's intermittent. I'm not talking about intermittent. Intermittent's great, but intermittent is not going to move the needle for most of us. Intermittent is not going to get the job done for most of us. Not so much again on just the weight loss initial, but the lasting weight loss, which requires improvements in our metabolic health and overall health. What will move the needle is longer fasting, which they call prolonged fasting. And this is where I came up with the flow protocol, FLOA, fasting like our ancestors, where, we get our patients into those weekly long fasts, fasting for, say, 36, 48 hours every single week. That sort of aggressive approach towards fasting will make, like, it pays dividends that I can't even describe. And I wish we had the research and data, and I hope one day that our patient results can be submitted in some sort of initial level study so that they can then maybe um, have motivation and reason to do bigger studies. But I mean, it's just crazy what we're seeing.
Hmm.
So massive improvements in insulin resistance, massive improvements in inflammation, and massive improvements in metabolic flexibility. So those two are the most important pillars right now. Again, I know I went on a deep tangent there. So we're talking about the pillars of lasting weight loss, and in order. After that, number 3 is resistance training. So that is the third most important thing. And then number 4 would be optimizing your supplement protocol, like getting a good supplement regimen and staying consistent to it twice a day, AM, PM, and then optimizing stress, optimizing sleep. So this is the order that I think would be representative of what most people should prioritize. And of course, there's going to be a ton of exceptions. Patients with autoimmune diseases have a new category to really think about, which is inflammation, which is, puts it up there up top. If you're an individual with a lot of stress, now optimizing your stress becomes a lot higher. And if you're sleep deprived, optimizing your sleep. So of course we can fine tune this to the individual. But for most people, this is the priority that they need to focus on. And so I prioritize it because I think that is sustainability. You can't
Hmm.
tell somebody, here's the 7 pillars, do them all. Because when you can't do them all, how overwhelming is that? Right? It's a very different flow when you walk into this project, to this new game you're playing, which is weight loss, thinking I have to do all these 7 pillars in order for it to work. That mindset is very different than, hey, here's the 7 things in order of most important, implement as many as you can. Very different flow. Now all of a sudden I don't feel like a loss if I can't get the weightlifting yet. If I can't focus on improving my sleep or my stress levels, like I can't, but I can start fasting. I can start changing my diet, then start there, right? And let those improvements pay dividends on their own, which fosters motivation, which fuels motivation to continue on the rest of the pillars. So I know I kind of digressed there, but I think that's a really important um, component, a component for people to kind of think with.
Hmm. And I have a question on Dr. Fung and where he stands, since we talked about him briefly. But before that, I just I had a fun thought. We're talking about prolonged fasting and weight training, and to a lot of people, I feel like that's a huge juxtaposition, right? Now, I happen to know that there's a kind of a big movement of even bodybuilders right now using prolonged fasting. Um, to build muscle and timing their diet, using that increase of GH to their advantage. But for everyone out there that hears you talking about prolonged fasting and weight training, this doesn't mean that we're trying to get everyone just to be super, super skinny, right? Because I can look at you. So, really quick, how does prolonged fasting and that caloric deficit over a prolonged period of time fit in with someone like you who's trying to maintain muscle mass and maintain peak health?
Yeah, absolutely. When it comes to a muscular physique, the two ways that you accomplish a muscular physique, a more muscular physique. Muscular does not mean you have to be as big as me or a bodybuilder status or anything like that. But we do know how powerful and how much healthier an individual is, how much longer they live with more muscle mass. And the movement and the understanding is I'm happy to see that I saw Rhonda Patrick literally say probably one of the most important things you can do is put on as much muscle mass on your body as possible. And I was like, whoa, 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 whoa. For me, if I applied that, but I'm like, I have these weird freakish genetics where my body puts on muscle mass like crazy. It's very rare. I put on fat like crazy too. So I have to bust my ass to get this lean and stay this lean. But the muscle mass, I am blessed with really good muscle building genetics. But for the rest of us, I get why Rhonda Patrick is saying that, because most people are struggling to put on muscle mass, so they should prioritize it. So that gives us a really good respect and appreciation for how important muscle mass is. Now, you have to be in a caloric. So taking a step back, two components towards building muscle mass, like with that sort of motivation, like Rhonda says, is both taking time where you actually are trying to increase the scale, like actually trying
Hmm.
to gain weight, which a lot of people are never thinking like that. But the part that we should also be considering is minimizing muscle loss during a fat loss program. That to me is so much more important, because if you don't prioritize the preservation of your muscle mass during your weight loss program, you will lose a significant amount of weight loss, especially on these GLP-1 medications. I think that's important to discuss too as well, because a lot of people think that these medications, and I even heard Dr. Atia talk about this, and I'd love to get on a podcast with him, because I totally and I agree with most of what Dr. Atia says, but I disagree with this. He's doing a lot of DEXA scans with his patients, and he's seeing muscle mass loss when they're on these medications. And again, I agree. These medications are going to create massive caloric deficits. And when you don't account for that, you're going to see a greater degree of muscle mass loss. The greater the caloric deficit, the more extreme that weight loss is, the greater the percentage of the muscle mass loss is going to be. And there's many variables: inflammation, how hard they're lifting, stress levels that are going to, and genetics are going to be variables for sure. Hormones like testosterone, there's a ton of variables. But at the end of the day, we know that to be true. And so you have to account for that, and what and consider the changes and influences in your hormones too as well. So we can't let ourselves go into a day by day caloric deficit if you're looking to preserve muscle mass. And this is why fasting, prolonged fasting, I think is so innovative, and you can build muscle mass. So for us with the flow protocol, we look at the week and say, look, let's get all of our fat loss in a day and a half or 2 days, or maybe 2.5 days, depending on where they're at and how aggressive we're being with the fasting. All of your fat loss for the week, let's get it done in those 2 days. The rest of the week, we want to contrast that with more muscle preservation, maybe even muscle building. Because I tell my patients, I don't care if you overeat. I need you to overshoot your calories on those 5 days so that we can land somewhere on the balance, because we don't want to undereat. Because undereating after a long fast, yeah, the weight flies off extremely fast, too fast, and creates that same sort of plateau and muscle mass loss. So we just have to account for it. We have to have structure and understand that on a weekly level, we're just taking our daily caloric deficit and we're jamming it into 2 days. And then we're getting enough protein intake on the other days. We're lifting on the other days. And why that's actually much more beneficial than what people might think is because of the hormonal improvements that we get from doing it like that, from partitioning your calories to a fasting approach and maximizing your caloric intake on the other days. You have dramatic improvements in growth hormone, and growth hormone is very anti-catabolic and pro-fat burning. You get an increase in the release of these fight or flight catecholamine hormones, which are protective against muscle mass and help mobilize free fatty acids. And now you are becoming more metabolically flexible. So your body's producing ketone bodies, at least during the fast, and the rest of the week, depending upon whether you have carbs all 5 days or whether you don't. But you're at least getting some ketone body exposure and release during those 2 days. And guess what? Ketone bodies are protective against muscle mass, right? So we have this hormonal shift that takes place from your prolonged fast.
Mhm.
So as long as you account for the calories, because that's the caveat right there. I would say without structure, without understanding, if you just tell someone to start prolonged fasting, I do think, and you tested that, you would probably get a greater degree of muscle mass loss because they don't understand those other pieces that we're talking about. So prolonged fasting without proper education probably is more destructive towards muscle mass long term, but it's actually more constructive and productive and enhancing if you understand those pieces that we're talking about, mainly accounting for the calories on the other days, consuming adequate protein, and of course, getting your lifts in. You got to get your lifts in.
Yeah. And I know what video you're talking about with Rhonda Patrick. At age 50, it becomes significantly harder to put on muscle. By your 60s, definitely 70s, it's much easier to catabolize, and you're trying to mitigate as much of that as possible. And it's interesting. You look at women above age 65, one of the main causes of death is a fall. If you want to be specific, it's a fall from the eccentric motion. So you have the positive concentric contraction, the eccentric, the negative. So think going down a set of stairs, not up. So when you talk about building muscle as much as you can before you get to that age, well, when it comes to your bones, one, what does weight training do? It increases density, it prevents breaks. And if you're training correctly with your resistance, if you're building your proprioception, that is your body's awareness of itself in space, and if you're building your neuromuscular fortitude, your balance, you're not going to fall during that eccentric contraction. You're going to be able to go down those steps as you could in your 20s, 30s, 40s, etc. And so many people don't understand the value of weight training just for mobility and just for quality of life, and of course for the maintenance of weight as well. But moving on to
I
what
agree
I'm
with that
really interested,
100%, by the way.
yeah, yeah, Dr. Fung, because I believe, and if I'm butchering this, I'm sorry, so correct me if I'm wrong here, but I believe he did say that exercise is not necessary.
Yeah, and this kind of goes into the whole when he also says calories don't matter. And I get so frustrated because I get defensive for him because I consider him the godfather of this entire movement. He really set the tone for the insulin carbohydrate model, for the hormonal basis of obesity. It prior to his book, he's got 4 books: obesity code, cancer code, PCOS code, diabetes code, right? Prior to him, we were still stuck and I think we still are stuck, but I think we're a lot less stuck in this energy balance, this energy approach, calories in versus calories out being the end all be all for obesity. And it's our fault why we became obese, not the fact that the government had us switch our dietary approach from a higher fat diet to a lower carbohydrate diet and encourage snacking, which created chronically elevated. No, it wasn't that. Of course not. It was us. All of a sudden, we just lost our willpower and self control and started stuffing our faces. That's what the real culprit was. Anyways. So he told a beautiful story that needed to be told, and he did it the best way he possibly could because we don't have the human randomized control studies. And in fact, what we do have actually paints the picture back to calories. The most robust studies that we have looking at the best forms of fat loss actually tell us that when calories are equated for, it didn't matter about insulin levels. You could fast and go keto, which are the most effective ways to rapidly lower insulin levels, depending on how resistant you are. It didn't matter. If you're in a caloric deficit, you're going to lose the same amount of weight, which That's kind of what I was saying earlier, right? Short-term weight
Hmm.
loss is all about calories, but we're not talking short-term weight loss. When Dr. Fung is saying calories don't matter, he's saying at the end of the day, assuming and taking the principle of short-term weight loss and extrapolating that long term, it's not going to matter because the big variables that influence whether an individual ultimately lands into a caloric deficit or surplus, because it works that way too as well, is ultimately determined by your hormones, specifically insulin, because insulin is a powerful, powerful signaling hormone. When insulin levels are elevated, that is fat storage mode. But then what about the study here that says it doesn't matter? You'll lose the same amount of fat. You'll lose the same amount of fat when insulin levels are elevated or not on the short term. So let's kind of take a step back and look at this from maybe a comparison, right? At the end of the day, calorie deficit needs to be present for weight loss to occur. We have the studies that prove that, right? But what about a study that looked at in this situation, insulin levels were lower, insulin levels were higher? What did that do to long-term changes, right? What happened to their metabolic rate? What happened to their hunger levels, right? So where he comes in from looking at hundreds of other studies that we do have, and we have a ton of them, it's just they're lower level, they're not as high and robust as these human RCTs, which they get invalidated immediately. But when you have hundreds of them all aligning to tell us various pieces that confirm the bigger theory that he's trying to prove, it's like at the end of the day, what he's trying to say is that that signal from insulin is going to create some reactions from the body when you're in a caloric deficit versus when the insulin levels are not high there and you have that same caloric deficit. The lack of the higher insulin, that's going to be a completely different scenario. So that one's easy to understand. If you're in a caloric deficit and insulin levels are low, great. Lasting weight loss, the fat flies off, you're a fat burning machine. You don't get massive reactions from the body like increased hunger. You don't get this resistance from the body. So this is your Alex Hermosi. Just eat, just follow your calories, multiply by 20. It's super easy, guys. Just you'll be jacked like me all the time. And I love Alex Hermosi. Don't get me wrong, but he extremely oversimplifies a situation that if it were that easy, we've been following that game for calories for the past 60 years, and it clearly hasn't worked. So there's a lot more to it. And what is more to it is the second signal besides the deficit or the surplus of calories, which is the presence of insulin. And so when you again are in a calorie deficit, your body will lose weight, but when insulin is high, that's where you get different reactions. And again, those reactions manifest as either increased hunger or decreased metabolic rate. And this is that dreaded weight loss plateau that everyone is familiar with, right? The weight loss plateau. I was losing weight and now I'm not. Well, what do you think caused this all of a sudden stop in weight loss? Yeah, some people maybe they stopped dieting and maybe they started eating more, of course. Maybe they stopped, like you could have produced the stop in the weight loss. But for the majority of people who are still exercising, still consuming the same amount of calories, and all of a sudden now their body's being non-compliant, how is that possible? Because the energy balance has to be at play. So that's where we go, okay, well, maybe there's other variables besides how much exercise you're doing and how much you're eating, which we call that basal metabolic rate. 70% of an individual's metabolism, the amount of calories they burn at the end of the day, 70% of it, give or take, comes from internal machinery. Very little influence from the amount of exercise that you do. And how fast or slow that BMR is, that basal metabolic rate, can be heavily influenced by insulin. And so it gets really nuanced and it gets really tricky. And I almost forgot where we were going with that question, but I think like putting all those pieces together, when Dr. Fung is saying calorie, that's where we were going. So he's saying calories don't matter because at the end of the day, and he calls it that proximate cause versus ultimate cause,
Hmm.
right? That's what he calls it. And he even gives examples like the Titanic, right? And why did the Titanic crash and sink? Was it because they didn't turn the boat left? I might be butchering this, but was it because they didn't turn the boat left fast enough, or was it because the boat was going too fast to begin with? Right.
Hmm.
Another great example is when you look at alcoholics, right? Would you simply just say, stop drinking? You're drinking too much, and just pull the alcohol away from them, and that's it. That's it. Problem solved. Just pull it all. Or are there other factors that are driving an influence whether that person can actually adhere to an alcohol free environment? Are they going to go out there and drive and find alcohol and do whatever they can to get it? We know nobody is arguing that. We know there are psychological, environmental factors that play huge, that are huge variables for whether an alcoholic can adhere to their attempt to drink less. So why is there so much confusion with this? And a lack of acceptance that there's more to the equation than just being in that short-term caloric deficit. And so that's where Dr. Fung, he's talking about the weight loss, like the ultimate cause, right? And the
Hmm.
ultimate cause is the insulin. So
When do you see it actually getting easier for the average individual? And I know it's a broad spectrum, you can't cover everybody, but on an average, typical diet, typical weight, typical American, insulin resistant, highly inflamed, they feel like they have to scratch and claw for every quarter pound of fat loss, right? When does it at any point just get a little smoother, a little easier, a little more consistent? And when does the body start going along with the individual instead of fighting the individual?
yeah, if the individual is metabolically reasonably healthy to high
Hmm.
healthy, the weight loss should start immediately relative to how extreme the deficit is, right? And see, that's the thing, right? But we're talking about people who don't have it that smooth, right? Which is probably the majority of people because they're to some degree sick, metabolically speaking. Again, it really depends on what population we're talking about. So if we're talking about the really sick, the obese, the insulin resistant, the PCOS, it won't even start at all for these people, the menopausal women. It won't even start at all, the weight loss, until they hit this threshold, which is like a big improvement in that insulin resistance and beginning to really lower their insulin levels. And then once that switch turns on and the weight loss starts coming, then it's just a matter of adhering to a program that lowers those insulin levels. So for that category of people, we see usually if they're not in a plateau when they come to us and they can start the program like full bore and we don't have to fix the plateau. We usually can get some weight loss coming off their body within 2 to 3 weeks because of the aggressive nature of flow protocol. And then we keep that going, and the deeper they get into it, the more consistent they get with the fasting, the more that speeds up, and then eventually we get them into that range of 1 to 1.5%. So, I believe you were asking how long does that body stay consistent with weight loss? It's kind of the opposite. It's more how long does it take to get them into that groove where they're finally losing. And as long as they don't let themselves plateau by under eating on a weekly basis, they'll continue to lose weight once we can get through that threshold. Does that answer your question?
Yeah, my main question was how long does it suck? When does the body start agreeing with you and producing what you're looking for
Couple
to
weeks.
to
So
some
then,
extent?
so then now, if we're defining that as the starting point of the weight loss, a couple weeks, 2 to 3 weeks.
And what might be more applicable, and I'm sure a lot of people want to know the answer to this, it's me. If I'm already losing weight, let's say I'm doing the flow protocol. Well, if I'm doing the flow protocol, I'm definitely losing weight. But like the majority of people out there, not weight training yet, and absolutely no idea what the hell to do. Because I'd imagine a lot of people out there are faced with that issue, is not a clear understanding of weight training, and it's very intimidating. I mean, if you remember your first time on a gym floor, you're looking around, everyone's grunting. It's tough, right? It's intimidating. As kind of a second tier to that, for the majority of people or those who don't have access to a gym facility, because I do think that has to be addressed as well.
What do people do if they don't have access to a gym?
So, two questions: how do they get started for those who are already losing weight? They understand fasting. They're doing something similar to this protocol, or they're doing the protocol. What's starting block A? And question number two, for those who have no access to a facility, to a gym, where can they start?
Well, how about this? I'll answer question one, and I'll defer to you for question two, because I think you have probably have more knowledge in category two as far as not having access to a gym. For people that do have access to a gym, I think the starting point, honestly, is getting a personal trainer for 5 to 10 sessions. I mean, we're talking a couple $100, depending on the gym, and maybe 5 sessions is like $400 or something like that, and 10 might be like 800 or something like that. You can always haggle and negotiate, but I think that is the most powerful way an individual can really confront weightlifting. If you really want to be effective, I would actually do as much research and studying before you even get your first session. So let's say you are on a budget, and let's say like you're going to make this investment because you trust what I'm saying. How can you get the most out of it? Learn as much as you can before your first session. Like, don't sit there and spend your time having the trainer teach you stuff that you can learn for free on YouTube. So we have tons of great videos about weightlifting when it comes to both on our free YouTube page, as well as in our full university, our platform for teaching people in our various coaching settings. But just the basics of weightlifting, understanding the structure in terms of sets. What does a set mean? What does a repetition mean? What does muscular failure mean? And what does muscular failure supposed to feel like, right? What's creating that burn in your chest when you're pressing, motion within the shoulders, for example, during that movement, understanding a little bit of like program design, and even watching as many videos as you can of how to do certain exercises. If you spent several hours doing this before your first session, you're going to save yourself probably 3 to 4 sessions right there, because now you can go into the session, and now you just need that final piece, which is visual representation and practical application, because now you're doing it. Okay, I remember seeing this in the video, and the trainer's like, great. And it's very different than, okay, let me show you how to do this, and this is your
Right.
first time, seeing this. I mean, both of us managed gyms, way back in the day, so this, and I know you know this very, very well. But yeah, I think understanding as much kind of preliminary stuff, and then getting with a trainer, um, because the pieces of showing you, helping you understand the burn, pushing you beyond your own initial limits, because that's another piece. Some people, when you tell them muscular failure, they get it right away, and they're going to pure muscular failure. Other people, and this is no judgment, might be afraid of that burn. And that's an understandable response, because pain generally means bad. But weightlifting is one of the few times where you actually are taught to push through the pain. That's a horrible thing to do most of the time. Most of the time, you should not push through pain. But
Right.
there are pains you should avoid. So how do you know what's good pain and what's bad pain? Again, generally speaking, joint pain is bad and muscle pain is good. But having a trainer sort of help you experience that and understand that, I think is invaluable. And so
Mhm.
I'd say starting off with a personal trainer is a phenomenal starting point for people that do have access to that, of course. Hey guys, I wanted to interrupt for a quick minute. If you are looking for a free guide where I break down step by step how to implement prolonged and longer fasting successfully, I'll link to it in the show notes where you can get a free copy. Now, back to the show.
Gotcha. So the second part of it was what to do without a facility, right?
Yeah, yeah. Well,
Um,
because I know you've definitely been in this in the trenches, doing that with helping people when you were managing multiple gyms. So what was your guys' go to for that?
Rule number one really is you cannot discount the effectiveness of calisthenics. You really can't. Body weight workouts. Um, One of my more fun hobbies back in the day is every once in a while you get someone in the gym who, oh yeah, I'm top athlete in my class. You can barely make me sweat. Blah blah blah. And I'd say, okay, you know what? Today we're not going to do anything more than 10 pounds. And it was always fun just to watch them at like the 15-minute mark. They were done, just torch, and they can't believe it, right? But to that idea, TRX bands. You're familiar with TRX body workouts. A lot of people don't know they were invented by a Navy SEAL, and the reason for that is You had these SEALs being deployed, and oftentimes they're in these safe houses. They were waiting to go on their mission. And depending on where they were staying, they had literally no way to work out. And if you're stuck in a room for months and you're at your peak physical performance capabilities, you do not want that to go away. And TRX was a way to have these straps. You can put them on a tree, behind a door, and suddenly you can do literally every muscle group, every body part that you can think of. And so, anybody who can buy TRX bands, they have a ton of online videos that come with them. It's a great way to get at home workouts. But even your air squats, push ups to failure, different abdominal routines, there's just so much that you can do at home. And again, there are thousands and thousands and thousands of videos on YouTube to take away from. And then, of course, as you know, I'm a huge fan of HIIT training, high intensity interval training that can be done anywhere outside, and you can do it to your capabilities. And I mean it when I say to some people, HIIT training is a very light walk for, let's say, 5 minutes and a power walk for three. You know this, people who are incredibly deconditioned, who haven't worked out for years, that is actually going to elicit change and push their body, right? Then you have the opposite end of the spectrum where it's full on run from a cheetah for the next 60 seconds, and then you get 2 minutes, 3 minutes. There's different ways to vary HIIT training, but you get your rest after that. So HIIT training is always going to be beneficial because even if it's just cardio, you actually see typically some muscle gain even through just cardio-based HIIT, which is incredible. And your calisthenics, even without any bands, anything like TRX straps, you're always going to be able to do calisthenic bodyweight workouts at home. And on top of that, not just workouts, but if you want to practice diaphragmatic breathing and slowing down your heart rate and getting rid of your stress, you can wake up in the morning, bend your knees, crunch your abs while you breathe. There's so many different things that you can do, and we'll cover those in different videos. Ways to move your body that wouldn't be defined as categorically resistance training or anything that's high intensity that's going to break you down, but still give you a ton of physical and psychological benefits throughout your day.
So TRX bands would be your most inclusive at home gym, probably cost effective too, right? I mean, what does an entire TRX system run out of curiosity?
About $200, not cheap, but I mean, compared to a gym membership and a personal trainer for months.
Well, that's not bad for somebody who doesn't have access to a gym. I mean, compared to like alternative of trying to get buy actual weights, like that's yeah, I think that's challenging. And you would start with a tier. So for people that are completely out of a gym, like you make that investment of 200, like you said, right? There's all your workouts for TRX are free on YouTube, right?
I wouldn't even start with TRX. I'd probably start with a yoga mat, a set of resistance band from Amazon, 10, $15, maybe 5, 10 pound dumbbells. That's it. You get that, you go on YouTube, you have more than enough for, I mean, a year if you really wanted to go there. You'd be surprised. You're talking about every plane of motion known to man. All you got to know is the actual movements, the patterns themselves, and there's no shortage of information online there.
Yeah, I think, and this is why I know you're going to be starting, hopefully in what 6 months from now, you're going to be creating
Hmm.
the workout series for people. I'm definitely excited for that. I know we're going to be implementing whatever you create in the flow protocol because I think that is missing, and I think that having some sort of platform to be able to learn how to weight lift and start in a comfortable environment before you kind of progress, I think is very, very powerful. So definitely looking forward to that. Hopefully you think 6 months is reasonable.
Absolutely. I mean, here's an example. You watch Brian Johnson. You've seen his morning routines. You've seen how he actually does corrective movement to start his day. If you have a $3 set of bands and you're internally rotated, which I don't know, 70% of people are, and you're losing weight and trying to feel better and get rid of that neck pain, you could be sitting doing work at a computer, talking on the phone. You have some bands and you're doing external rotation right here. I know this because I used to do it myself, right? And so many of these modalities, it's not just about losing the weight like we talked about before. It's about pain, it's about function, it's about mobility, and it's about your final decade. And so much of this can be done in off time with the kids while you're on the phone. I mean, it really is hilarious. The kids will see me sometimes doing single leg pistols on the couch, sitting down with them while they're telling me about their school day. It's hilarious, right? But once you kind of gather the tricks and tools to the trade, and you remove all of the mystique from it, it becomes very uncomplicated. It's just really getting your ball bearings going and diving in the beginning.
Yeah, that's definitely going to be an awesome thing that you're going to make there. We have awesome mobility platforms like K over T, and we're never going to try to replace what they do, but with what I'm thinking, what I'm envisioning is a platform where they can learn how to resistance train from home, and the emphasis is the muscle stimulation for lasting weight loss. Like
Yes.
that's the key. So almost like we can work in conjunction with the K over T platform, but K over T does not focus on overall muscle development for the goal of, because we need to hit all major muscle groups to prevent muscle mass loss.
And exactly, at the very least, we need muscle innervation. At the very minimal, if you're losing weight, especially dramatically, if you're fasting, you have to engage the muscle. If not, we already know what the body's going to do and what it's going to turn to when it's trying to lose. It will catabolize that tissue. But it's, as you know, it's more than that. It's really about function long term, and people just have no idea how little work it would take to maintain what they have now when they're 90 years old. And I don't know about you, but I love the idea of living my final days still able to go up my stairs without being in pain.
Oh yeah, and the studies that they've done on this, all cause mortality
Yep.
decreasing with muscle mass on your body. And it just it's logical, right? The think of your elderly, that the ones that have more muscle on their body versus the ones that don't, right? Your fragility, your body falling apart, so to speak, is going to be a direct result of having less muscle mass to support it. Not to mention, less muscle mass more means more pain, means less activity. Now you're not as happy, so then the depression sets in, and then you're even more in pain because you're depressed. And it's a vicious cycle. But you age gracefully, like aging gracefully. One piece of that means maintaining muscle mass. Build the muscle mass now so that you can be healthy, so that you can look great and feel great. And as you age, just focus on maintaining muscle mass. And if you're older, old, if you're older watching this, no hard feelings. You're never too late to start building muscle mass. If you don't have it now, build it. The ideal way is build it now when you're young, middle age, and just maintain it. It's so much easier. But don't feel like it's impossible if you're 65 years old and you're frail. You can start this now. And it'll be one of the best choices you could possibly make.
Agreed. And if nothing else, if you want to start somewhere, get your protein up. Whether your goal is weight loss, muscle gain, get your protein up. Um, is your recommendation about whatever your goal is, your body weight goal in grams of protein?
Yeah, I find myself kind of sliding up the scale a little bit. So the range, the minimum would be target weight, goal body weight in
Hmm.
grams of protein. So, because again, most of us have a much higher percentage of body fat, and we're trying to just get healthy. And so the goal weight is sort of an assumption of, okay, you are a higher percentage of your weight at that point is going to be lean muscle mass, lean body mass. And so we want to have that many grams of protein, right? Similar to the concept of, a lean bodybuilder doing grams of protein per day, grams of, total weight. Well, they're lean, right? So yeah, most of their current weight is muscle mass. So they should be consuming a gram of protein. But when you are heavier and you have a larger percentage of body fat, you don't necessarily need the extra protein to support the fat mass. Now, could you
Right.
eat higher protein? Absolutely. And higher protein diets have been associated with better weight loss. Because anything first of all, protein is very high on the satiety rating. You know, you get full, you try to stuff your face with even steak, even fatty steak, because fat and protein is very high amount of fullness. It's
Mhm.
really hard to stuff your face with that compared to carbohydrates. Significantly easier to overeat carbohydrates, but and so you have a much higher fullness rating. And then anything extra is just going to be converted into glucose via gluconeogenesis, which is a process in the
Mhm.
body where your body just converts those, literally shuttles those amino acids down a pathway to produce glucose, and it's very metabolically costly process. So I wouldn't go balls to the walls with protein, because I do think we do need to consider kidney health, but I think somewhere between target weight and current weight is a good range, and that range depends on how high your body fat percentage is or isn't.
Mhm. It's been fun, man. Let's definitely get to more of the biomechanical program design side because I think there's just a lot of things that people can learn just to get them started that aren't nearly as difficult as they might think.
Yeah, absolutely, absolutely. I mean, a full episode on just getting into the nuances of resistance training, program design. Then we can get to high intensity cardio, and then we can talk regular steady state cardio, because I'm not against it. There's a time and
Mhm.
place, but understanding how to approach it and how to incorporate it, I think, is invaluable information. So
Awesome, man. Thanks again.
absolutely, we'll see you guys later. If you guys found this informative, then you're going to want to click this video right there. It's a continued explanation of what you learned today, guys. Knowledge is power, so let's keep this going. We'll see you later.